it's a pleasure. Unfortunately, I cannot see all of you, but I have heard your presentations. They're brilliant. And I wish I were with you if, in person, but this time it's not possible, unfortunately. So next time I'll be there with you for sure. So today I will be talking about access to HIV medicines in Eastern Europe and Central Asia and improving access through medicines patent pool. So let's have a quick look at some medicines for treating HIV, but also for treating some other infectious diseases. These are just examples, and these are just some selected medicines. And in the right column, you can see the year when patents expire. And what does it mean? It means that before patents expire, generic versions of these medicines will not be available in countries unless licenses are issued. So this graph nicely shows what happens when generic medicines enter markets in low and middle income countries. First of all, as you know, the price for generic medicines is much lower than the price for originator medicines. Then there is generic competition happening between generic manufacturers, which leads to even lower prices. And that, in its turn, leads to increased uptake. In other words, more countries and more people in low and middle income countries are getting access to the needed WHO-recommended medicines, the medicines that were mentioned by Stella in her presentation. And the question is, how do we get generic medicines to countries? Like, how do people get access to essential WHO-recommended medicines? And this is where medicines...
Mila,
sorry?
Can you share your presentation on a full screen?
Yes, I thought it is on a full screen.
Thank you.
I'm sorry. Now, is it better now?
Yes. Yes.
So, sorry about that. So, yeah, this is where Medicines Patent Pool, or MPP, comes into play. So, Medicines Patent Pool is a UN-backed public health organization established by UNITAID back in 2010, initially with the aim to improve access to new HIV medicines for low and middle income countries. And then, since the model has proved to be working well in HIV at the request of WHO, governments, communities, and other stakeholders, we expanded our mandate to viral hepatitis in 2016, and then other patented essential medicines recommended by WHO in 2018, or those with the potential to be recommended by WHO, and COVID-19 in 2020. UNITAID still remains our main funder, and we are also funded by the Swiss, French, Japanese, Canadian, German governments, and by WIPO. So this is our operating model. Probably you have seen it earlier, but I assume also there are new participants who never heard about Medicines Patent Pool. So this is how we work. So we are in the middle of this model. You see Medicines Patent Pool. And what we do, we approach patent holders who are to the left. Patent holders are pharmaceutical companies holding patents for essential medicines, for new essential medicines, because new medicines are patented usually, as I said. So what we do, we negotiate licenses with them for needed medicines, and the need for medicines is identified in close collaboration with WHO, with governments, with communities, and other stakeholders. And as soon as licenses are signed, and I say it like easily, as soon as licenses are signed, but in fact it's not an easy job. So we try to do our best to include as many countries as possible and to negotiate licenses and most public health-oriented terms and conditions. So as soon as licenses are signed, we sublicense as many generic manufacturers as possible, or as many as necessary to ensure generic competition, which in its turn will lead to further price reductions. And that's how low and middle income countries, in fact, most of them, including many upper middle income countries, got access to WHO recommended medicines. And that's how people in those countries are getting medicines. And I've heard earlier you were talking about dolutegravir and TLD and other medicines. So that's how those medicines are getting into countries, to people into countries. This slide is very busy. We don't have to get into all details here. This is just to give you a sense of all the products licensed by Medicines Patent Pool from patent holders for different disease areas, for HIV, COVID, viral hepatitis, long-acting therapeutics, cancer, etc. And this slide gives you a sense of health and some of the economic impact of MPP license agreements. So we work with 22 patent holders, big pharmaceutical companies having patents for new medicines. We have a whole network of 58 generic manufacturers producing therapeutics and supplying them to low and middle income countries. More than 43 billion doses of treatment have been supplied by MPP licensees, or we call them MPP generic partners, those generic manufacturers that you saw in the previous slide, to low and middle income countries. And as of now, 148 countries have been benefiting from MPP licenses, and almost $2 billion US dollars have been saved by global health communities through MPP licenses by the end of 2023, and the new data for 2024 will be issued soon, hopefully. Very often we are asked this question, why licensing through MPP is a win-win approach, and especially like how patent holders are benefiting from this collaboration or generic manufacturers. So, excuse me, the answer is for patent holders, working with MPP is an impactful way and very effective to make available innovative products for low and middle income countries. License management is also done by MPP. They don't have to do that. Reduced distribution costs means that distribution is done by MPP generic partners. And also for patent holders, working with MPP means also opening markets in low and middle income countries through these licenses, because otherwise they used to work only in high income countries, the countries of interest, and they never work in low and middle income countries, because as we know, like most governments and most people in low and middle income countries, they cannot afford buy medicines at originator price. For generic producers, working with MPP means a quicker way to develop affordable versions of new medicines, but also those MPP licenses enable them to develop formulations such as, for example, pediatric formulations, and fixed dose combinations such as, for example, TLD. Governments and treatment providers that can stretch their budgets and treat more people with WHO recommended medicines, and communities, of course, they get greater access to quality assured affordable therapeutics. I think I did not mention before that quality is assured by WHO pre-qualification. We closely work with the WHO headquarters on ensuring the quality, but also FDA approval counts, and also approval of other stringent regulatory authority, but WHO PQ is a preferred way to ensure the quality for us and for our manufacturers. Let's have a quick look at our dolutegravir license. Probably you have heard in the conference in Munich that we marked a 10-year anniversary of the license in 2024. Dolutegravir was approved by US FDA in 2013 and licensed by VIV to MPP in 2014. And uptake of dolutegravir started slowly in 2018 and gradually increased, as you can see from the graph. And by the end of 2023, more than 24 million people are on the dolutegravir-based regimens, meaning dolutegravir, TLD, or ALD. And the price for dolutegravir, probably you know it better than me, is below 45 US dollars per patient per year. And more details, if you want to know more details about this license implementation, you can find them by the links below. These two maps give you a sense of the uptake of dolutegravir products all over the world. For example, you can see that 59 million packs of dolutegravir 50 milligram have been supplied to 126 countries, and more than 1 billion packs of TLD have been supplied to 107 countries. Among those, there are 34 upper middle income countries. Not just lower and lower middle, but also upper middle income countries have been benefiting from MPP licenses. Very quick look at our progress with the dolutegravir license, which is a new license, a separate license for Azerbaijan, Belarus, Kazakhstan, and Malaysia. These countries are upper middle income countries, and as I said, there are 34 countries benefiting from the main dolutegravir license, so this license is separate. In these countries, dolutegravir is also patented, but the problem is that, unfortunately, these countries are seen by pharmaceutical companies as commercial, or as those being able to pay a full price, like originator price for the new products. And that is why, starting from 2017 up to 2019, First, it was Malaysia, and then Belarus, Kazakhstan, and Azerbaijan were approaching MPP and VIV with requests to look into possibilities or to look into options how we can get generics available in the countries. Because the price for originator product in that country, for originator dolutegravir was in those countries was more than $2,000 per patient per year. So in 2019, we started negotiations with an MPP because we was a patent holder. And by the end of 2020, the negotiations were over, so the license was signed. And that license happened thanks to close collaboration with the governments of the 4 countries, WHO headquarters, WHO Europe, and also WHO offices in some country. Of course, community groups and civil society, like advocacy, played a key role in making it happen. Some key features of this license: the license covered only these 4 countries, those countries, the governments of which approached MPP and VIV with this request. So it enables generic manufacturers to supply dolutegravir and TLD to these countries. 3 manufacturers, Hetero, Mylan, and Sun, are developing and supplying dolutegravir and TLD or other dolutegravir regimens. Same as other MPP licenses, this license does not set prices. However, it is structured in the way that the more governments procure, the lower the prices go. And which means that it gives incentive to governments to make transition to dolutegravir as soon as possible, as recommended by WHO, and to cover as many people as possible in the shortest possible time. So this is how this license works. And this is just to show that how uptake increased since the license was signed. So again, the license implementation started in 2021, when the uptake was less than 10%, and in 2020, for example, the uptake was 0 in all the 4 countries. Then, for example, in Kazakhstan, procured the volumes enough to cover 86% of people on RT treatment, on RT by the end of 2024. Belarus 78% and Azerbaijan 72%. In Malaysia, the progress is slower, but Malaysia is planning a big scale-up starting from 2024. And this graph demonstrates the price reductions as compared with the originator price. And you remember the graph that I showed you at the very beginning, what happens when generic enters the market. And here is a demonstration of what happened when dolutegravir generics entered the market in these 4 countries. So the price dropped down by more than 90% in Azerbaijan, Belarus, and Kazakhstan. And even in Malaysia, where procurements were the volumes were lower, the price dropped already by 75%. This table shows the whole procurement volumes for some countries of Central and Eastern Europe and Central Asia. And for some countries, the data will be added soon. It's been collected. So all in all, more than 10 million packs of dolutegravir products, which means dolutegravir, LD pediatric, on dolutegravir pediatric and TLD. So they have been procured in the region. A few words about MPP pediatric dolutegravir license. It covers 123 countries, and just wanted to note that every time I say it covers, it means that these countries can procure from MPP licensees. They have access to generic medicines pre-qualified by WHO. And sales outside of the licensed territory are also possible if there is no patent infringement. The license doesn't contain any royalties. It's a pediatric license. And quality is ensured same as in all the other licenses by WHO pre-qualification or stringent regulatory authority. So this map, the map to the right, to the left demonstrates the coverage of the license, all the countries that can benefit from the pediatric dolutegravir license. And the map to the right shows the uptake. So pediatric dolutegravir has been rolled out massively. More than 8 million packs have been procured by more than 100 countries. The good news is here that pediatric ALD has been also developed by MPP licensees. It's a new pediatric combination. However, the scale-up is not yet happening, probably because governments are not yet aware of that. But Stella, correct me if I'm wrong, but I think pediatric ALD is also recommended by WHO as a first-line treatment. And it is important that governments and other stakeholders are aware of the availability of this pediatric formulation, which can further improve treatment outcomes for children. And more details by the links below. A few words, and this is the last section of my presentation, a few words about our license for long-acting cabotegravir for PrEP. So the license covers 90 countries. You can see them in green, in dark green, and 46 more countries with no patents that they can also benefit from the license. They can procure from MPP licensees. So the effective license territory is countries in direct coverage and indirect coverage. Direct coverage is 90 countries, indirect 46 countries, plus 5 more will have access to generic cabotegravir after 2026, 2027, including some UMICs. In Eastern Europe and Central Asia, let me just move it a little bit. I wanted to show you the countries in Eastern Europe, Central Asia, which are here, just a second. So in Eastern Europe, Central Asia, Ukraine, Kyrgyzstan, Tajikistan, Uzbekistan, Mongolia, Kosovo, Serbia, and Georgia can benefit from the license. In other words, they can procure generic long-acting cabotegravir as soon as it is on the market. And it is expected, it's been developed by MPP licensees. It's a complex product, so the development is happening. And given that there will be also needed time for WHO pre-qualification to ensure the quality, generics will be ready to enter markets in 2027, 2028. More details by the links below. Next, oh, I cannot switch. Sorry, something happened. I cannot switch my slide. Just a second, bear with me, please.
Is from your side?
I don't know what's actually happening. Let me see. I don't know. Yeah. In any case, so I just let me. Okay. Yeah, it just got frozen. Everything. Yeah, I see. No, I don't see. Apologies for that. This is technical. Yes. So finally, some conclusions. Thank you for your patience. Talking about our region of Eastern Europe and Central Asia, so availability of multiple generic versions of key treatments, it was the key main step for enabling significant price reductions for ARVs in the region. And this was possible thanks to voluntary licenses negotiated with industry by Medicines Patent Pool. MPP licenses enable procurement mechanisms to benefit from generic competition, which is important, and of course collaboration with stakeholders like governments, WHO, civil society, communities. Also advocacy of community and civil society played a critical role at every stage of the process, at every stage of license implementations. So that's it from my side, and please do not hesitate to get in touch with me in case you need anything, you need more details about the licenses or access to the mentioned medicines or other medicines not mentioned in your country. Thank you. So I stop sharing my screen then.